I cannot think of a better time in our lives for our membership to propel oral health research to new heights. Based on technological achievements in genomics, proteomics, metabolomics, bioinformatics, systems biology, and in so many other areas, we are poised to make tremendous strides, enabling us to advance the 4 Ps of healthcare in this century, a term coined by the biologist Leroy Hood, describing our ability to be predictive, preventative, personalized, and participatory. Translation of rapidly growing scientific and technological advances relies on strong relationships across multiple disciplines. There is nowhere else that I know of where these opportunities are more accessible than I see within our own organization. Within the AADR, every discipline and field of oral health research is represented. We have members from every dental academic institution throughout the nation who attend AADR meetings to meet with colleagues, to share their research findings, and to join in cross-disciplinary collaborations. There are many of us who have never missed an AADR meeting, which is a testament to the importance of this meeting to our personal and professional development. In addition, the AADR is fertile ground for the development of budding new researchers who will continue to advance oral health research for generations to come. Yesterday, we held our annual faculty development workshop to provide mentorship and assist this new generation of researchers in their careers. We also held a joint symposium with the American Association for the Advancement of Science on Science Communication Fundamentals, which is an essential element for our success in advocating for and securing funding to support the science. We must also know how to communicate the science to ensure that there is knowledge transfer to practicing clinicians and the public of the advances that are being made in oral health research. Incorporation of these advances into clinical practice will improve the clinician's ability to prevent, diagnose, treat, and manage chronic diseases, while ensuring more predictable outcomes for the procedures and therapies that are currently administered. These advances will also allow for patients to become more active participants in maintaining and sustaining their oral health, all of which will significantly improve on the overall health of our nation. Our members are involved in basic translational and clinical research that is published in top-tier journals, including our own high-impact Journal of Dental Research, as well as our new JDR CTR. Our close relationship and partnership with the National Institute of Dental and Craniofacial Research is an important element for the success of our constituents. The presence of NIDCR staff at our AADR meetings is a key benefit which enables young trainees, postdocs, and faculty researchers from across the nation to meet face-to-face with NIDCR staff and senior administrators, fostering the submission of new and innovative science to government agencies for funding. In collaboration with the Task Force on the Design and Analysis in Oral Health Research, we recently submitted an R13 grant to support our upcoming full-focused symposium to be held at the NIH campus from November 8th through 9th. Put that on your calendars. Highlighting the science and technology leading to advances in precision oral health, which will be published in a special issue of our journal, Advances in Dental Research. AADR has secured funding from the Food and Drug Administration's Center for Tobacco Products to host an additional conference entitled Oral Health Effects of Tobacco Products, Science and Regulatory Policy, to be held on September 14th in Bethesda, Maryland. Experts in tobacco product research and policy will highlight the often overlooked harmful effects of tobacco products on the oral cavity. This conference will engage researchers in providing evidence to support the FDA's mission to make tobacco-related death and disease part of America's past, not our future. And by doing so, ensure a healthier life for every family. Recognizing the importance of the next generation of researchers, the advocacy groups that our research is designed to aid, as well as the excellent research being conducted by our corporate members, we have recently added 3 new board seats to allow for representation of these important constituents on our board. The application and further development of new and innovative technologies would not be possible without our industrial partners, who possess the technological resources to scale up internally developed innovation, as well as those licensed in or created with academic research partners. The great advances that have been made through academic, government, and corporate partnerships are essential to the advancement of the science. The AADR has created a collegial and scientifically rich environment that fosters the bridging of science and technology and enables new innovations in diagnostics, prognostics, therapeutics, and prevention to become a reality, advancing oral health. I look forward to serving you this year by sticking to the 4 Ps that I believe will help us advance oral health. We must focus on the people in our organization who are the dedicated and innovative researchers with the persistence and perseverance to move the science and technology forward that we are all so very passionate about. I would like to close with this very special thanks to my incredibly supportive family whose encouragement and love have provided me with endless possibilities. I look forward to seeing you over the course of what has shaped up to be a great scientific meeting at a beautiful venue with wonderful people. Enjoy the meeting.